Hello dear friends, very warm welcome to all of you at our conceptual brainstorming integrated session of anatomy, and especially we are going to integrate this topic with radiology, but we will talk about the surgery points, about our medicine points also in this class. So according to the National Medical Commission, according to our competency based medical education, we are going to look at the different aspect of this system topic. So before watching this video, it is important to look the topic of our previous videos, how to study the neuroanatomy to make easier. Yes, it is also important to look about the meninges as well as CSF. So we are continuing the session. After that videos, one by one, step by step, we are going to understand the different thing. First, we are going to make our proper basics. See here, what is the meaning of the cistern? Yes. So before talking to our radiological aspect, definitely we have to know about our anatomy aspect, basic things. Cistern means our reservoirs. Please prepare your notes also simultaneously. So first thing which you have to remember, cistern means reservoir, means it is a space where, you know, your question that CSF lies in which space. So I'm making unmute to all of you so that you can participate actively in our class. So can you tell me, yes, CSF is situated in which space? Above the dura mater, below the dura mater, or below the arachnoid mater, or below the pia mater? What is your answer? Very nice answer. So you can say cisterns, these are reservoirs of CSF. First point, definitely. In which space? Definitely in subarachnoid space. Clear everyone? Fine. Now we are going to do one diagrammatic presentation so that you can understand in a better way. So let's start. We talked about the definition. Now we are going to talk about the different system in our central nervous system. So central nervous system, yes, it is having the brain. Suppose this is our brain, cerebral hemisphere. Now see here, this brain is having the brainstem. Agree? So this is our diagrammatic presentation of the brainstem. Suppose this is our brainstem, which is consisting of the midbrain. Then midbrain is continuing as the pons. So this dilatation is showing the pons. Then pons is continuing as the medulla. Yes. Suppose this is our brainstem part. Then this brainstem medulla oblongata, it is continuing as spinal cord. Yes, sir. It is continuing as spinal cord. After which foramen? Foramen magna. The terminal portion is dilated like the cone, which is known as conus medullaris, from where the final terminal they are arising. And you know, behind our pons and the medulla, there is our little brain, cerebellum. So this is our diagrammatic presentation of the cerebellum. Fine. Now, do you remember there is the covering? There is a covering of the meninges around our brain. Yes, sir. Especially we are talking about the arachnoid matter. Why we are talking about the arachnoid matter? Because CSF lies below the arachnoid space, below the arachnoid matter, that is our subarachnoid space. So especially here we are drawing our arachnoid matter. So just to see here, follow the green color. Yes, sir. Arachnoid matter is covering our brain along with the other meninges. But now see here, there are formation of few spaces. See here, this is arachnoid matter, which is not too much closely attached to the brain, but pia mater is attached. So near the our lateral circles of the brain. Yes, try to understand here this portion. I will teach you in brain portion. This is our lateral sulcus. So what is happening? Our our arachnoid matter, it is reflecting here, and when you will observe in three-dimensional way, you will get here is the one space just below the our arachnoid matter. Got the point? So this is the site where the CSF is accumulating little bit. So this is the reservoir of the CSF. Fine. Further, More points we are going to observe. You can look that these meninges, our arachnoid matter, it is running in this way, and just in front of the pons it is again leaving the space. Yes, here is a comparatively large collection of the CSF showing with the blue color. So this is the reservoir of the CSF, and in the same way just in front of the pons again here is the location of the reservoir of the CSF, which is cistern. Now our meninges, it is continuously running with the pons, but in front of the our pontomedullary junction again it is leaving the space. Are you able to catch? Yes. So again one space is formed, which is CSF containing reservoir. Then you can observe that meninges is continuously running with the brain tissue closely attached. Fine. So what I want to tell you, these blue color structures are cistern spaces. So one by one, observe here. This part is our lateral sulcus of brain. So this space is known as, yes, first point, it is known as cistern of lateral sulcus. Yes, it is the space at the lateral sulcus. So it is the our reservoir of the CSF at the lateral sulcus. Fine. Now try to understand our this portion. Yes, you can observe this portion is in front of our midbrain. Definitely, sir. This portion is midbrain. Here is pons, and then dilated part is medulla. So we will learn in front of the medulla there is a cerebral peduncle. So there is a right cerebral peduncle and the left cerebral peduncle. Space between the two cerebral peduncle, that is our interpeduncular fossa, where there is the chances of the CSF accumulation, which you can see here. So this portion is nothing, it is our cistern known as interpeduncular fossa. Got the point? Next, another reservoir of the CSF which is in front of our pons. So you can give the name. This is our cistern at the pons. So you will say cisterna pontis. So this is our third cistern. Fine. Now come down. Yes, we are coming down. So these meninges are making dilated space here, which is, yes, again reservoir of the CSF, and then running straight. So there is no reservoir of the CSF. So you can observe here is a large reservoir of the CSF. This is known as, yes, lumbar region. Yes, it is the region at the lumbar part. So definitely lumbar reservoir. So you will say lumbar cistern. Remember, this is the site where we perform lumbar puncture. So yes, this is our lumbar puncture site MCQ. Fine. And this MCQ is many time asked. What is a lumbar puncture? It is the site from where we can remove the CSF and we can do the proper study of the CSF for the meningitis and other brain related disease. Please go for our previous videos. Okay. Now see here, we are performing the lumbar puncture at which side? Can you tell me? Lumbar puncture is performed at which vertebral level? Answer is L3, L4 vertebral level. And another point, how you will identify this L3, L4? You will identify with the our iliac crest. Getting the point? So you will see at this level iliac crest. I will tell you in the lower limbs, the hip bone, iliac bone. See here, with our proper three-dimensional orientation. Yes, observe what is the iliac crest. Yes, sir. This is the our lower limb hip bone. So when you are observing the back side hip bone, so it is having the thick upper border. This thick upper border is known as the iliac crest. This is located at our L3 L4 level. At in between that L3 L4 you will introduce the needle. Fine. So this is our point related to the lumbar cistern. Now further try to understand these meninges, they are going above, but again near the medulla it is creating one space close to the cerebellum, and then again very close to the cerebellum it is running fine above. So you can observe one more space is formed close to the our cerebellum and the medulla. So this is known as fourth. Then you can give the name fifth. This is our largest cistern. So we say cisterna magna. This is just a diagrammatic presentation. So what you can remember, this is the cisterna magna, which is also known as our cerebello, because it is formed in between the cerebellum and the medulla. So cerebello medullary cistern. Getting the point? Now see here, this our meninges arachnoid matter, it is again running above, fine, but it is creating one more space behind the midbrain and the pons part just above the cerebellum. Okay, and then it is again closely running to the our brain portion. Fine. So there is a formation of CSF space just above the cerebellum again. This is our cerebellum, and this portion is indicating our cistern of the great cerebral vein of the Galen. Please go for our general anatomy video. I told you this is known as simply the cisterna ambiens, which is related with our great cerebral vein of what? Galen. Okay. So do you remember the Galen was our anatomist who was related with the dark era of the anatomy, क्योंकि वो एनिमल पर डाइसेक्शन करता था और कुछ कुछ चीजें फॉल्ट रहती थी जिसे पूरा वर्ल्ड फॉलो किया. So that is not the exact correct era of the anatomy. There was the few fault in the anatomy. That's why that era related to the Galen, who was considered as फिजिशियन ऑफ द एम्परर, राजाओं का डॉक्टर इसे माना जाता था, बहुत फेमस फिजिशियन और सर्जन था गैलन. ओके, सो दैट एरा अप टू द 1500 ईयर दैट वाज कंसीडर्ड एज द अवर यस डार्क एरा ऑफ द एनाटॉमी, जिसको किसने करेक्ट किया? वेसेलियस ने. दैट्स व्हाई वेसेलियस वाज कंसीडर्ड एज अवर फादर ऑफ मॉडर्न एनाटॉमी. ओके, सो इन दिस वे you can remember the different cistern. Getting the point? Again you can focus. We had studied our first cistern, cistern of lateral sulcus. Now we are going to make a detail. Then we had studied our interpeduncular fossa, better to say in this fossa interpeduncular cistern. Fine. And then we have to study in detail cisterna pontis. Also we studied about our lumbar cistern. Then next we had seen the cisterna magna, and then cisterna ambiens. There are the other terminology also which you will follow, which you will see in the different portion, but these are the main and important our cistern. Getting the point? Now after this all, we are going to look the detailed portion of the each cistern. Fine, but before that, see here, we are going to look a few diagrammatic images for our different cisterns. Also you can follow the BD Chaurasia sir textbook. See here, can you follow this image? Yes. Same image is here. Try to understand. There is the our largest cistern, which is between the medulla and the cerebellum. That is our cerebello medullary cistern, cisterna magna. Got the point? Also, you are looking the prepontine cistern or cisterna pontis. Fine. Also, you can observe our another space interpeduncular cistern. Fine. Here you can see the great cerebral vein of Galen. हमने इसको head neck face portion में भी देखा था. So this is our cistern known as cistern of the vein of the Galen, also superior cistern because it is just above the our cerebellum. Okay. Also is the quadrigeminal cistern क्योंकि ये कॉर्पोरा क्वाड्रिजेमिना के बहुत ही क्लोज होता है. आराम से धीरे धीरे, कोई हड़बड़ी नहीं है. फाइन. Now few small cistern like cisterna chiasmaticus, optic chiasma. Yes, this is our pituitary gland and here is our optic chiasma. So just near to the our pituitary gland there is the space. There is a reservoir of the CSF that is known as the chiasmatic cistern. Fine. So these are our different points. Now try to understand. We are going to talk about the our different more points. Yes. Uh, we are, yes, you can follow the BD Chaurasiya also. Please follow the recent edition. Yes, this is the image from the BD Chaurasiya sir. I'm going to tell you the page number also. These are the detailed classes from the basics to the top clinical level. Yes, you can follow the page number 29. Fine. So here this image is given. Please follow this image from the BD Chaurasiya sir. 4th edition neuroanatomy portion. So what are the different cisterns which are seen here? The largest cistern, cisterna magna. Look at this position. Yes, sir. First, largest cistern. Can you see? The another cistern, lumbar cistern. Second is given here. Fine. You can observe other cistern like cisterna pontis. Third one, just in front of the pons. You can also observe, yes, interpeduncular cistern. Fourth. Fine. And here you can see, yes, cistern of the great cerebral vein. Okay, so this is our fifth. Fine. And you can observe the other cistern, cisterna, our chiasmaticus, prechiasmaticus. This will be found near the optic chiasma, not shown in this image. So these are the different points. Okay, remaining things about the flow of the CSF we had already seen. So this is our integration with the textbook. Fine. Now we are going to talk about the each cistern in detail. Okay, so try to understand. First we are going to talk about the our, yes, cisterna magna. Yes, but can you tell me before that all radiological integration? Okay, so we are going to look for the cisterns of the brain in radiological images. So trying to look for the any good image. See here, radiological integration. If you are having the idea about the anatomy, हमने images देखे, then you can easily understand. It is not a good image. We are looking for this image. Fine. So now just compare with the anatomy. अगर आपकी anatomy strong है तो हर subject strong होगा, like our this radiology also. Can you observe here our soft tissue, scalp, skin? Yes. Then can you see our bone? This is our bone with the outer and the inner table. Yes. This is our skull bone. Radiology integration. Fine. Can you see the brain tissue? Yes. This is the brain. Fine. Now can you observe this structure? Later in the neuroanatomy, I will tell you this is the white band matter which is connecting the our right and left cerebral hemisphere. Can you help me? What may be the name of this structure? Yes, exactly. You can see in your BD chorosia. This is the our image of the corpus callosum. Are you getting the point? Yes. This is the our corpus callosum. So integrate with the radiology. So this structure is nothing. This is our corpus callosum. Yes, sir. This is our corpus callosum. Fine. Now, see here. Can you tell me what should be the name of these structures? Just we had drawn the diagram. Yes, 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 yes. What should be the name of these structures? Yes, very nice. So you are saying the answer about the radiology. This is our cerebellum. Here the brainstem is there. So this is the midbrain. Am I right? What should be the name of this structure? Pons. So this will be our medulla. Yes, you all are now in this stage that you can understand the gross images of the CT-MRI, X-ray, this all. We will differentiate the CT-MRI, X-ray later, but right now the basic points you have to remember. Can you see here? This is our skull bone and this is the margin of the nose. Here is our upper lip and the lower lip and then chin region. Getting the point? Now, try to understand. See here, if this is the midbrain, so can you help me? Any recess, any cistern just in front of the midbrain, what should be the name beta? Yes, yes. Very good. It is our interpeduncular. Fine. Cistern. Am I right? Fine. Now, if any cistern space is present in front of the pons, then what should be the name? This will be very good. This will be the position of the cisterna pontis. So, if any patient is coming to you and any artery is ruptured here, so you can say the blood will be found in the cisterna pontis. If any blood mass is present in this our interpeduncular cistern or any arteries ruptured here, you will see in finding that blood will present in our interpeduncular cistern. So these all the different findings you will correlate. Fine. Now, can you tell me in this image what should be the name of this cistern which is close to the medulla and the cerebellum? Yes, this will be our cerebello medullary cistern. Also, this is known as very good. This is our also cisterna magna. Getting the point? Fine. Now, try to understand. Can you tell me the cistern which is just above the cerebellum? You can say superior cistern. Also, you can say cistern of our great cerebral vein of the Galen. Okay, not important. For the congenital anomaly, we will see later. But yes, this is our cisterna ambiens or cistern of the great cerebral vein of Galen. This is our cisterna ambiens. Clear, everyone? Getting the point, beta? So this is our radiological integration. Fine. Don't worry, we will take the separate session for our radio and our anatomy integration. But right now we studied this all the images. So immediately we had observed. But now we are going to look the details and the more clinical points about each cister. So now first we are going to talk about our first cister, that is cisterna magna. Okay, so what are the different points which you have to remember? First point, it is largest cistern, MCQ. Second point, it is located between medulla and the cerebellum. And cerebellum, so also known as, yes, cisterna, yes, cerebellomedullary cistern. Getting the point? Okay, नाम को तोड़ो और सोचो, it is between the cerebellum and medulla, that's why cerebellomedullary cistern. Now try to understand what are the different contents. Yes, we are going to look for the contents of this space. So later when I will teach you the artery, then I will tell you. See here, there is the medulla. Yes sir, medulla is bulb like dilated structure, so I am going to draw the medulla. Yes sir, central elevation is known as, yes, I sent you the videos of the free neuroanatomy tract part, so please follow that videos. If you all are not having the videos, you can message at 91317 for the different free videos at the YouTube channel, sequence in sequence as well as at the app. So this is our medulla, which is bulb like dilated portion. Getting the point? And then lateral part is known as, yes, can you help me better? Yes, 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 please answer. So yes, yes, this is our medulla, which is nothing, it is the extension of our spinal cord. Yes, very good, that is the olive. So there is our olive. So just one simple diagrammatic presentation for all of you. Fine. Now we are going to, yes, please keep mute your background beta. Okay. Now try to understand what is happening. Fine. See here, there are the two arteries from the right and from the left side. They are coming from the vertebra. That's why these are known as the vertebral artery. So what you will see, there is our right vertebral artery. There is our left vertebral artery. Both the arteries are coming from the right and left side. Diagrammatic presentation. Fine. Okay, sir. And then both the arteries are uniting together. Later I will tell you. And then it will run at the base of the brain. And then it will again divide into the two different branches. Fine. I am showing you the three-dimensional orientation. Again, see here. Can you observe this three-dimensional orientation better? See here. Yes, very beautiful. I am enlarging. Fine. Go slowly. Understand the concept slowly. So there is one big artery which is going to supply our brain region. This is common carotid artery which is dividing into the external as well as into the our internal carotid artery. Fine. So this is a common carotid, external carotid and internal carotid artery. But see here, there is one artery. Yes, this artery is running through the our cervical vertebra, foramina transversorium. Okay. So this is running through our vertebra. That's why it is known as a vertebral artery. So it is very close. It is very close to the our medulla. Can you see this artery is ascending and then it is reaching to the suboccipital triangle? Do you remember suboccipital triangle? It was asked in our previous year exam. So it is running close to our medulla oblongata. Fine. So it is reaching upside. And now try to understand. I am giving the labeling. Yes, these are our vertebral artery. Yes, vertebral artery. This is our right vertebral artery. Here is our left vertebral artery. Fine. Both are uniting at our base of the skull. Better to say our pons. So just above the medulla, you know that there is the location of the pons, and this medulla, this pons is having the central depression. Yes, sir. So this is the diagrammatic presentation of the pons. Suppose this is the pons. So there is the depression which is known as the basilar sulcus. Both the arteries are uniting together and making basilar artery. I will teach you in the circle of Willis later. And then it is going dividing into the branches on the backside. Getting the point? Okay. So now try to understand our more points. Yes, try to keep mute your background beta. Fine. See here. So these two arteries are uniting and making very important artery, that is our basilar artery at the base of the brain. Fine, at the base of the pons, at the brain stem, and then it is dividing into the our two posterior cerebral artery. So these are our more MCQs. Getting the point? Fine. Now try to understand our different points step by step. Okay. Yes, Hussain Shakir, please keep mute your background, but noise are coming. Okay. So what we are going to look, the different arteries. Try to understand our more points related to our cistern. See here, these vertebral arteries are giving one very important branch, that is known as the posterior inferior cerebellar artery. Very important. In short, we say the pica. Yes, this is our posterior inferior cerebellar artery. What we are saying in the short, PICA. Later I will tell you that rupture of this pica artery or the our vertebral artery, it results in very important clinical point, that is our lateral medullary syndrome. Yes, these arteries are ruptured in pica syndrome, also known as lateral medullary syndrome. Very important MCQ. Different MCQ we had solved from here. How sir? See here. Question. How the basilar artery is formed? By the fusion of right and left vertebral artery. Yes, basilar artery is found at, you can say, at the basilar sulcus of the pons. Next question. The basilar artery is dividing into which artery? Answer is two cerebral artery, two posterior cerebral artery. Next question. You can say that in case of the pica syndrome, or better to say lateral medullary syndrome, which arteries are getting rupture? Answer is the pica or the vertebral artery. Now what is the important point related to our cistern? Yes, see here, these our pica and the vertebral arteries both are, yes, vertebral artery and pica, these are content of cisterna magna. Getting the point? These are very close to our cerebellum portion. Yes, these are very close to the our cerebellar portion. Fine. So this are inside our cisterna magna. So try to understand. In case of the rupture of this artery, in case of the lateral medullary syndrome, you will get blood in the cisterna magna. If you are inserting the needle, you are removing the needle, you can get here the clot, the blood, and the different situation. Clinical integration more better you will see in your related subject, but right now with anatomy, radiology, integration, you can look this point. Also this basilar artery we will see. Can you tell me here which cistern was found just in front of the pons? Yes, very good. This is the pons, here is the medulla. Fine. So can you integrate with your clinical point? that if you are getting the blood in cisterna pontis, yes, here will be the our cisterna pontis. So it is the content of cisterna pontis. If you are getting the blood, if you are getting the clot, if you are getting the rupture of any artery in the cisterna pontis, means that is the rupture of the basilar artery. Fine. So these are our different points. So what I want to tell you, that content, yes, again we are looking what are the important contents of what, cisterna magna. MCQs. First, you have to remember that is our vertebral artery. Agree? Also, you will see the our pica artery, posterior inferior cerebral artery, origin part, starting part. Okay. Then you will also observe there are the cranial nerve, ninth, 10th, 11th, 12th cranial nerves. Getting the point? Fine. Again, I want to recall you. We had seen midbrain, pons, and then medulla. Fine. And I taught you the central elevation is our pyramid and the lateral elevation is olive. So we had seen that ninth nerve, 10th nerve, 11th nerve, they are coming lateral to our olive, and the 12th nerve is coming lateral to the pyramid. Yes. So what are the different cranial nerve? You can remember 9, 10, 11, 12th. So these are our different cranial nerve, and here is the location of our cerebellum. Yes. So these cranial nerves are very close to the this our cerebellomedullary system. So remember, these are also the content of cerebellomedullary system. So these are the different points which you can remember. Okay. Now further we are going to talk about our next cistern, that is cisterna pontis. So many things we had seen about our cisterna pontis in above the diagram. Now we are going to look the more details. Fine. See here. First, we are going to look for the location. Yes, it is located where, in front of pons. Agree? Then it is continuing. It is continue with. It is continue with superiorly and inferiorly. Superiorly, it is continue with the midbrain cistern. So you can say interpedunculaar cistern, and inferiorly, yes, better to say posteriorly, not the inferiorly. We are saying the posterior side. So just recall posteriorly which cistern is situated, our cisterna magna. Okay. Now we are going to talk about our content. So already we had drawn the diagram previously. So what are our contents? First, yes, we had seen the basilar artery. Agree? Which is giving the branch anterior inferior cerebral artery its origin part. We will see later. But yes, basilar artery you can remember. Also here the 6th, 7th, 8th cranial nerve. So origin part 6th cranial nerve is related here. So we will see one cause. 6th cranial nerve is the most common most common nerve which is getting damage in rest ICT. One of the answer will be that 6th cranial nerve, it runs in the our cisterna pontis. We will see. But this point is important. Okay. Now we are going to look for the our third cistern, that is interpedunculaar cistern. Fine. So we are going to talk about our interpedunculaar cistern. Okay. So this cistern, first point, it is cistern located between two peduncle of the midbrain. Yes, it is cistern located between two peduncles of what? You can say midbrain. Okay. And then another point, the contents. What are the different contents? So you can say the bifurcation of the basilar artery first, and can you recall the basilar artery was going and it was dividing the two posterior cerebral artery. Okay, so it was dividing into the two posterior cerebral artery. So posterior cerebral artery, they are also located here, and it is the midbrain portion. And in the midbrain, which cranial nerve is located? Yes, our third cranial nerve. Fourth cranial nerve is not. Why? Because the fourth cranial nerve, it comes from the back side. Okay, so we will see in more detail in our cranial nerve portion, but these are the important content. Now we are going to look for the next cistern, that is our, yes, cistern of lateral sulcus. So we are going to talk about the cistern of lateral sulcus. So only few points are important for this lateral sulcus. See here, it is located on the lateral surface of the brain. Again, can you recall? Yes, sir. This was our lateral sulcus. Can you see the lateral sulcus? Yes. So here there is one artery of the brain, very important artery, middle cerebral artery. I will teach you in arterial supply of the brain. So what you have to remember right now? Yes, location. It is situated on lateral sulcus of definitely brain. Second point, what you can remember, the content, very important, that is our middle cerebral artery. So if any artery is getting rupture in radiological examination in our lateral sulcus part, then it is the rupture of the middle cerebral artery. Fine. Next, another cistern, that is cistern of great cerebral vein of Galen, or you can say cisterna ambiens, that is our great cerebral vein of Galen cistern. So just few lines about this cistern. It is not too much important, but just one little knowledge we have to know where it is located. First point, location. You can say just above the cerebellum. That's why we also say this one as superior cistern simply. Second, contents. We are talking about the contents. So here is our great cerebral vein of Galen as the content, as well as we will see the pineal gland, the third eye of the Lord Shiva. भगवान शंकर की तीसरी आंख यहीं पर होती है. Okay, so later we will observe, but you can follow right now. Again, what you can see, yes, see here, just below the cerebellum, cisterna magna, just above the cerebellum, there is a cistern of the great cerebral vein, and this is closely related with this mass. This is our pineal gland location. I will teach you. Fine. And here you will see the great cerebral vein of Galen also. Fine. Now, after this all, we are looking for the more things. See here. Yes. After this, we are going to look for our lumbar cistern. Very important again. because it is the site for the lumbar puncture. So this is our lumbar cistern. Fine. What you can remember? First point, we are talking about the location. Okay. So what you will say, that it is located at terminal end of what? Of spinal cord. Okay. Yes. At which region? You can say at our lumbar region. Okay. At which portion? Definitely at L3, L4 level. Getting the point? And another important point, definitely it is site of our lumbar puncture. I will take separate class for this one. Okay. So these are our different important MCQs. Fine. So after this all, we are going to look the more clinical points. See here. Now we are going to talk about our clinical anatomy. Fine. So what are the utilities of this cistern? So we are going to focus for this clinical portion. So first point, what you have to remember, that cisterns, these are best places for, yes, CSF removal. अगर आपको CSF निकालना है for the examination, okay, then it is the best site for what? Definitely CSF examination. And when you have to perform the CSF examination in case of the infection, inflammation of the meninges, so you can say meningitis, etc. Like the our hemorrhagic cases also seen as arterial rupture also, okay, etc. investigation. Fine. So this is the best site. So this is the first point. Another point, what are the different methods of the CSF examination? Anybody, can you help me? Yes, methods of CSF examination, कुछ नाम तो हम पहले ही पढ़ चुके हैं. First and the best, definitely lumbar puncture. It is best method for the CSF examination, where we perform at lumbar region, better to say lumbar cistern. Okay. Any more puncture you know? That is our cisternal puncture. We can perform the cisternal puncture. This is performed at cisterna magna. Fine. But this is dangerous. Why? Because just in front of the cisterna magna, there was the location of medulla. Fine. So if there is a medullal lesion during this cisternal puncture, there may be the death. Okay. Another method, that is our ventricular puncture, which is performed in the children. Within the ventricle you will go. Fine. So just few images for our lumbar puncture. In detail I will tell you later. Yes. This is the method of the lumbar puncture. Fine. You are asking the patient to lie down, and then you are inserting the needle in between the L3 and the L4 vertebra, piercing the different structure and reaching at the site of the yes, CSF, where the spinal cord is end. Yes, spinal cord is ending at this level, so there is no damage to the spinal cord, and spinal nerves are there, but these are thread-like structures, so they cannot be damaged. Fine. Now we are looking our, yes, cisterna magna puncture. So in previous class also we had seen, again just few images. Okay, see here, this image will be useful for all of you. Yes, this image is getting little bit blur, so try to find out any better image. We are including the both image. See here, what we are asking the patient, we are inserting the needle from the back side, because we know that cisterna magna is located just below the cerebellum behind the medulla. Now you are inserting it above the our which vertebra? This is first cervical vertebra. Fine. And then you have to move slowly. Only when you have to perform, when you cannot perform the lumbar puncture. It is a dangerous method. Okay. Too much skill is required. अब आप इसे insert करेंगे धीरे धीरे and as the pressure is relieved, okay, then don't go forward, because there is the our medulla, and medulla is the vital center for the heart rate, heart, lung, all. If you're moving forward, means there is a damage to the medulla, so don't move forward. And what is the direction? Yes, you are directing this needle towards the just above the nose, that is a nasion. Okay, in between the two eyebrows, just at the root of the nose, there is a nasion. So you are moving towards the our, yes, nasion point. Fine. So this is our nasion. Yes, it is dangerous. You are puncturing the largest cistern, that is cisterna magna. Now there is the our one more method, ventricular puncture. So showing you the ventricular puncture also. Can you observe this image? So very interesting. You all will do these things as you will proceed in medical field further. So can you see? Yes. Here is the our location of the ventricle. Can you see? This is our lateral ventricle. So again, when we will observe the ventricles in detail, we will see this all the topics. So you are introducing the needle from the nose, okay, making 45-degree from the horizontal plane and reaching into the our lateral ventricle. Fine. So yes, it is not easy. It is also dangerous, but sometimes these all the procedures are required. So this is our ventricular puncture. So these all are the our different details about the ventricles. We had completed the yes, we had completed the meninges, CSF, and this was the about the ventricles with proper integration to the radiology. Hope you all enjoyed the class. Thank you very much. Now we are starting our live doubt discussion session. Thank you.